Welcome back to National Report. Here's the latest now on the novel coronavirus. We're going to start in Italy, the second hardest hit nation after the United States. Over the weekend, the number of confirmed cases in the country topped 97,000. Italy has the highest number of deaths, reaching almost 11,000. As Easter approaches, more than 11 million people tuned in to watch Pope Francis deliver a blessing in an empty St. Peter's Square. The Pope saying this: the pandemic has taken over our lives, but reminds us that we are all in the same boat, end quote. And this comes after the Italian Prime Minister said the European Union could, quote, lose its purpose if it failed to come up with a strong response to the coronavirus threat.
And
the serious health impacts of COVID-19 initially seemed to threaten older people above the age of 60, but the pandemic has proved that it knows no age, as younger people around the world have been seriously infected as well. Joining us now to discuss this very thing, that is Dr. Roger McIntyre, president of CRTCE and CEO of AltMed. Doctor, good to see you. New data is showing almost half of New York City's COVID-19 patients, they're under the age of 45, and about 12% of ICU admissions are people 20 to 44 years old. What are your thoughts on that?
Well, it's a pattern we haven't seen before. The question is, why are younger people in North America seemingly more affected than elsewhere? We don't have the answer to that, but I want to, in fact, just raise something which I think is an additional concern here, and that is we are all very concerned about some of the projections yesterday from the task force at the White House in terms of the estimated mortality from this virus. We are also additionally interested in the mental health consequences, which in many ways affect younger people to a greater extent than older people, that being depression, people resorting to alcohol misuse and suicide. This is a very serious issue because this assault on our society is not just a medical assault, it's a financial assault, it's an economic assault, it's an employment assault. And what we learned from the Great Recession only a decade and a little bit ago is that for every 1% increase there was in unemployment statistics from the Great Recession, we saw a 1% increase in suicide, and younger people are more at risk. So as we think about younger people, the question's twofold. Why are they getting more COVID here in North America? And secondly, this is a group that was particularly affected by suicide, depression, and alcohol misuse from the Great Recession.
Well, I want to your point, I want to show this because over the weekend, police in a town in New Jersey, I'm just reading this report here, and that's the second hardest hit state after New York, had to break up a party with almost 50 people crammed in a 550 square foot apartment. The organizer, we're told, was charged. New Jersey Governor Phil Murphy, you're seeing this on your screen, he tweeted this out. He says, I can't believe I have to say this at all, let alone for the second time, but here we are. No corona parties. They're illegal, dangerous, and stupid. We will crash your party, you will pay a big fine, and we will name and shame you until everyone gets this message into their heads. Doctor, your thoughts on that?
Well, there is, in fact, a recognition that not everyone's taking the government recommendations as seriously as they should be and implementing them in terms of their actions. I think we're all concerned by that story that you just mentioned. The other part is that it's also, I think, true that some people, more than others, just don't quite have a concept of how serious this is. In the medical world, we call that hypocognition, just not getting it or just not hearing the music. And I think for a lot of these folks, yes, there's irresponsibility, and for some, it's immaturity, and they're obviously being very silly. For others, they just don't quite have a concept of how serious this is. And look, I think that the public health officials have been unambiguous. There needs to be social distancing. There needs to be respect to what's being recommended. And I think we're all reacting negatively. But I think also what I do wonder aloud about is that we're being told to stay in our apartments, our homes, and be distanced. This is not normal. And this level of social isolation does affect some age groups to a greater extent more than others. And it is absolutely the case that younger people react more negatively to social isolation. This is in part why we got a loneliness epidemic amongst young people. So I think we need to, yes, let's respect the recommendations from public health officials, respect the law, but I think we also need to understand that younger people are especially vulnerable to some of these recommendations around social isolation and are especially vulnerable to some of the adverse mental health consequences of being socially isolated and looking at job insecurity and losing their economic, security.
Yeah, there's so many different aspects, doctor, to look out of this. Obviously, the medical aspect, but then the economic aspect, the loneliness aspect that we're starting to see now, and so many other things. That's Dr. Roger McIntyre, president of CRTCE and CEO of AltMed. Thank you so much for joining us.